Hello and welcome everybody to this webinar hosted by the National Wellbeing Hub in Scotland. I'm very pleased to be here to present along with Alistair Dobbin, low mood, what it is and what helps. So we hope you find this afternoon helpful. We provide a resource on the National Wellbeing Hub of a Feeling Good app. We are both the founders and we're very pleased that you're able to access this help free of charge on the app, on the website, and you will find free codes, access codes. And also on this website, there's lots of other information which is really helpful for you. So as next slide, please, Alistair.
Oh, sorry, yeah.
Wake up.
Right.
Yeah. So as I said, I'm Sheila Ross. I'm a psychologist and a psychotherapist, and I'm here with Alistair Dobbin, who was a GP in Edinburgh for over 30 years and works out at the Edinburgh University. He's an honorary fellow at the university and involved in medical student education. So, okay, so next slide, Alistair. So quickly before we get into the body and the meat of understanding low mood and what it is and what we can do to help, just to signpost you to the National Wellbeing Hub. As you go onto the homepage, it says free apps. Next page, please. And when you click on that, you can see Feeling Good. That's one of the apps. So click on that and it takes you through to a page which, it's a video you can watch, a couple of questionnaires just about where you work and what sort of work you do. And once you fill in those, they're anonymous. Next page, you get a couple of codes. The codes, these are codes. Well Good is the username and positive is the password, and these you put in the app once you download it, and there's links to download it there. Next page. And this is what it looks like on the App Store, free to download. Next page. And this is where you're taken to after terms and conditions to put in the username and password, Well Good and positive, and that will unlock the whole app for you free of charge. Next page, please. So, okay, so let's think about how do you know you have low mood? What is low mood all about? So I'd like just to get you thinking around this topic for the next sort of 45 minutes. So I'd like you to just think about this and put your answers into the Q&A box. Now the Q&A box is up in my teams, and I think they're all the same. There's two little speech bubbles overlapping. They've got a question mark in it. When you click on that, you will see the chat box, and you're able to put in comments. So yeah, have a think. Just think. How do you know you have low mood? What is your experience of low mood? How does it feel like? Or what do you notice in other people
who have it?
Yeah, that makes you think. Okay, someone's just asked me to confirm the username again. Username is Well Good and the password is positive.
We'll flag it up at the end of the presentation.
Yeah, we'll flag it up at the end as well.
Time to, and there'll be a slide of all the resources at the end, and we'll let you, take a picture of it or whatever.
Yeah, and you can always find information through the Wellbeing Hub website. So, okay, so how do you know if you're low mood? Somebody's saying irritable. Yeah. Teary. Yeah. Not having motivation to do things. Oh, totally, I know. Feeling tired and heavy. Lack of interest and focus. Lack of patience. Numb. When I'm in a low mood, I don't want to talk to anyone. I just want to lie in the dark room and sometimes have a little cry. Yeah, so that's withdrawing socially, not wanting to talk, feeling sad, feeling teary, someone's already said. Yeah, absolutely. Lots of really pertinent descriptions of what it's like, lack of motivation, and others can be very irritable and short. It's one way that we can recognize in other people. No motivation, avoid social situations, eat lots of junk food. Yeah, that's sort of, it's trying to self-soothe, isn't it? Feeling down, disinterested, irritable, no energy, unmotivated. These are great. Everybody's sort of, we all recognize struggling to get up for work in the morning. That's right. So sometimes we don't sleep well. And so even although, so we can be tired, quite often we don't sleep well, I think, if we're down. No motivation, low energy, eating too much, tears, fatigue, no appetite, not motivated, lots of great things. Everything's such an effort. Yeah, want to sleep, cry. That's the withdrawal. Yeah, these are all super. Yes. So withdrawing, numb, loss of generosity. That's an interesting one. That's right. You know, I guess we get a sense of caring less about others, I think, isn't it? That sense. Feeling flat, uninterested, feeling no control. Yeah, that's a expecting the worst to happen. Absolutely. Stop. When I get low mood, I stop doing things that I know can help, listening to music, pull back from friends. Now that's interesting, and we will definitely be coming up at the end. We're going to be talking about what we do to help. So hold on to that, and we'll tell you about how you can make that switch so that you can get into that, helping yourself again. Over preparing, overthinking. These are all really, really insightful, really super comments. So thank you. I'll just pass over to Alistair now. Hello, Alistair. I can't hear you. Are you? I know I still can't hear you. Are you muted? Definitely can't hear you. Jen, I don't know if you can check do anything.
I'll try this one.
Oh, that's you muted. I can see that. Click that unmute. Oh no, maybe try speaking now. Okay. Okay. Next. Can you just put it back onto the presentation for just on the presentation for a moment, Jenna? Everyone, give me 5 minutes. Okay, I'm going to go and see if I can help out. Okay, Jenna, can you just?
Yeah. I can hear you now, Alistair, but it's very faint. I can.
Okay, so I'll just carry on. Thanks for your forbearance. What I'm going to do, hang on, just. Okay, so we were talking about. I think you covered most of these things. Poor sleep, particularly at waking up through the night. That's the problem with low mood. You wake up in the middle of the night, can't get back to sleep. Poor focus and concentration, tired all the time, withdrawn, avoid socialization. Yet all of these things have been covered. Possibly not lack of positive feelings. I mean, that's almost more of a technical term, but that's certainly true. You cannot. It's very hard to experience positive emotions. You know, if something happens that might normally make you feel happy, you can't feel happy inside. And we'll be coming back to that because that's an important point, and there are ways to increase your positive feelings. Okay, so we're going to have a quick go at looking at some very interesting research. What does research tell us about low mood and depression? So we're going to look at a study that was done in America by the National Institute of Mental Health, one of the largest studies of depression ever undertaken. And what happened was, don't worry if you don't understand all the terms, I'm sure probably most of you do. They took a whole bunch of people, about 250 people, and they divided them at random into 4 groups, and they had 16 weeks of treatment. So the 4 groups were, one group got cognitive behavioral therapy, CBT, which is a way of looking at your thinking errors, and they had support of a psychologist. Another looked at interpersonal therapy and a psychologist, slightly different from CBT in that you try and approach it through what's happening with your relationships. The third group got an antidepressant and saw a psychiatrist. I mean, all these people were seen once a week by either the psychologist or the psychiatrist. And the last group got a placebo, they got a dummy tablet, and they saw a psychiatrist. So, I mean, the psychiatrist didn't know who was on the dummy tablet and who was on the antidepressant. So they were treating them as if they all had the antidepressant. So 16 weeks, that's actually a lot of treatment. Every week they would see the psychologist or the psychiatrist. And so what was the outcome? Okay, well, we're actually going to ask you this question, which, it doesn't matter what you say. We're not going to judge you on it. So which group you think did best out of these 4 groups? Was it the cognitive behavioral therapy, or the interpersonal therapy, or the antidepressant, the people getting the antidepressant, or people getting the placebo? Okay, so these are the 4 groups. So if you'd like to tell Sheila which of these groups you think might have done the best.
Yes, put it in the chat box.
Yeah, we'll just spend a little time seeing what the general outcome is. Very interesting, a massive study. It was enormous. They filmed all the consultations and they examined all the
We're having a few answers in.
Okay.
Some people are saying 1, 2, 1. Someone said all the same. 1 placebo group. Someone saying 2. Option 4 CBT. Majority are saying CBT. 1 or 2 are saying number 5.
Okay.
Only one person so far said psychiatrist.
Oh, really? Okay. What psychiatrist and either of the psychiatrists? Well, that's very interesting.
The number 3. Only one said number 3.
Okay. All right.
Yeah, some are saying 4. So it's, yeah. Okay.
I'll maybe just move on. Thanks very much for all your replies. The answer is there was no difference between the groups. And this was 16 weeks of therapy. And nobody did better than anybody else. I mean, it was a very intensive course, actually, of treatment. They called it a short course in 1985. In fact, that's a massive amount of therapy. They checked again at 18 months to see if any group had done better. Again, no difference. So, what does it tell us? This is very interesting. I mean, what does it tell you that all these groups who were getting recognized therapy delivered by experts in their field, and they didn't do any better than getting a dummy tablet, a dummy antidepressant? No group did better. CBT, very intensive form of therapy, nobody did better than the placebo group. Okay, so they went back and they looked at all the things that they had recorded in all these groups. Because they asked them lots of questions to start with. They had to fill out questionnaires, and again, as I say, they were filmed. Every interview with a patient, with the psychologist or the psychiatrist, was recorded, and then a specialist would go over it to see whether they had a good relationship. And the best predictor of recovery was, well, there's 2 actually. One was the patient-therapist relationship. That seemed to be very important, and they measured that at the start of their second session. But the most important thing was the patient's expectation. Did the patient think that they were going to get better? So they were given a scale. how much do you think you're going to recover? So from 1, thinking not at all, to 5, which is, yeah, I'm really sure I'm going to get better. So this was a sliding scale. And they found that the people who expected to recover actually did better than anybody else, because there was no, as I say, no difference between the actual therapies. So so what it came down to is, if you thought you were going to get better at the beginning, this is actually before you actually saw a therapist, then you would get better. It's still important to have the relationship with the therapist. That was important, but if you didn't have the expectation of recovery, then you weren't going to get anywhere. And a number of studies have backed this up. A lot of the expectancy has been examined in all sorts of other cases, and these are various papers that you can get hold of. And they said, well, yes. Other people have said, yeah, well, expectancy causes the majority of change in treatments, not just for depression, but other psychiatric disorders too. So that's very interesting. And at the end, and the thing is, so the outcome really says patients who expect treatment to be effective engage more constructively in sessions with the therapist, which brings about reduction in symptoms. So we're going to just dwell on this for a bit longer. So the research showed that expectation, if you could see yourself recovering, if you could feel that you were going to recover and see yourself recovering, that's what drove recovery. I'm not saying that the other things don't have any impact, but we'll go into that later. So positive expectation it's like optimism. It's sort of hope. It's the ability to picture yourself actually feeling better, how you would act and how you would be if you actually saw yourself recovering. So you're able to have this sort of visualization, and it gives you a feeling of hope, and that, of course, that is very important. So really, I mean, we've got lots of different therapies here, and they all have various skills that they can help. And to a certain extent, one of the major skills, and probably the most important skill, is that they increase positive expectation, partly because you're seeing a specialist, so of course you think, oh yeah, well, this is good, I'm going to get better. But you've got to have that feeling at the beginning before you start. So, but once you're there, you think, oh, this person's really going to help me. So, just seeing a therapist will tend to trigger a belief that you're going to get better. Just here now, we're going to go basically, want to look at what is the main cause of people getting low mood, depression, distress, anxiety. The most significant cause of all these things is what has happened to you in the past. It's maybe something from your childhood, maybe it's something from when you were an adolescent, maybe as an adult who had PTSD from something, or you just had a bad experience. So this is what actually makes the difference. It's not genetic. Just because you had a relative who was depressed or had low mood, or it doesn't mean that you're going to get it. Genetics really has no impact on whether or not you get distressed. And personality type, again, are you an extrovert, an introvert? Used to be thought that would make a difference, but again, that has been disproved. Genetics disproved, personality type disproved. So that only really leaves what's happened to you. So and this is getting more clearer and clearer. I mean, we haven't got everything about genetics sorted out yet, but there is no clear genetic cause of depression or anxiety or whatever. There may be a genetic cause of some things like schizophrenia or bipolar disorder, but all the other things, no genetic evidence, no evidence that genetics makes a difference. Personality type, people used to think that, and you still get quizzes in magazines and stuff, but the guy who invented the personality type, I think, has been largely discredited. He was making up the results of his research. So we have a new mantra really for mental health, for distress. Okay, don't ask what's wrong with me, instead ask what's happened to me. Okay, so we're going to talk about things that do happen to people. In 1994, this big study came out of ACEs, Adverse Childhood Experiences, looking at the impact of certain things that happened when you were a child. And what they found out, they had this is a huge study by an American health insurance. So this was people who actually didn't have any particular problems, and they just asked all these people, what happened to you when you were a child? Did you have, were you physically abused, sexually abused, emotionally abused, people ignoring you and not looking after your emotional needs? So I mean, the figures were absolutely staggering. 63% of people had had at least one adverse event as a child. And, 30% of men physically abused, 27% of women, and again, sexual abuse, very, very common. And 10% of everybody, 10% of all people had been emotionally abused. So, I mean, this doesn't necessarily mean when you talk about abuse or adverse events, we're not talking about something that you might call the police about, although, you might, I suppose, if it was obvious sexual abuse. But what we're talking about is like, I mean, I'm a very anxious person. A lot of doctors are. I mean, it's something that, you're picked to be anxious so that you look after your patients more carefully, and phone them up if you're worried about them. So, and why am I anxious? I don't know. I mean, sometimes it keeps me awake, sometimes, and I'm sure there is something from my childhood. My parents were, my mother was very anxious, and I probably just picked that up by being with her. Okay, so, and 38% of people had 2 or more categories, 12.5% had 4 or more. So, obviously, this thing, it's what's happened to you, really. And it's not that you know what's happened to you. We will go into that shortly, because we've been working with a group in Canada who's been looking very closely at all of this. But why can't depressed people, people in low mood or stressed people, why can't they just cheer up, for heaven's sake? I mean, look, you just you had a new grandchild, you should feel happy about that. The problem is, paradoxically, if you're in low mood, thinking of something positive memory, makes you feel worse. The reason is, it's just something we call a counterfactual effect. When you're thinking, if you think of a positive memory from the past, you compare it to how you're feeling now, and it makes you feel worse, because you think, oh yeah, look, I was a happy person then, and now look at me, I just mope about, and can't sleep, and so on. The counterfactual effect can be reduced generally by what we call decentering, which is like relaxation exercises, focusing on the body, mindful relaxation. And we'll be going into that later on. Sheila's going to take us through some great stuff. So, unhelpful thinking patterns. So if we look at, just briefly going to go into that. So here we are. So what on earth are these cows doing here? The reason I put the cows in is because something called rumination. Okay, that cows, you may know, have 6 stomachs, and they eat the grass, and they have one stomach, and that's beginning to digest it, and then it take it back in their mouth, they chew it a bit more, swallow it again. So they keep swallowing the same grass until it's reasonably digested. So rumination, though, when we're talking about feeling low, feeling bad about yourself and so on, rumination is repeated negative feelings. So you might be feeling okay for a bit, and then, oh no, suddenly you feel, oh no, it's not worth it, I'm too tired, I can't be bothered. These are the sort of things, this has been examined in bits of research, these are the things that if you are ruminating, this is the kind of thing that comes up for you. Why do I have problems other people don't have? What have I done to deserve this? Why can't I handle things better? Look, and what have I done to deserve this? And these are 3 very common ideas that people with low mood have. And also, another important point is you can't suppress these bad feelings. It's like suppression is not a strategy. So, if you're thinking, oh, I feel really bad, or you think of something from the past and it makes you feel bad, you think, put that out of my mind. But like the thing about the pink elephant, you know, if someone says to you, don't think of a pink elephant, it just keeps coming into your mind. You can't stop visualizing. Suppression is not actually a good strategy for trying to help you feel better. In fact, if you suppress a memory, you tend to get worse when something triggers that memory. So why is all this happening? Well, it looks like it's what's happening is you've got an unconscious link to things that have happened in your past. Something that's happened in your past, something that has given you a bad feeling. Now, these things are, we've been working with a Canadian research group, and they've been looking at various things about negative events, about things that have happened to you in the past. So people can remember that things have happened, but they cannot recall the emotions that surrounded that particular event. I mean, they might know, oh yes, you know, I remember I had a car crash, and you know, it was pretty bad, and I can remember when it was, and so on. What they blocked out the really nasty bits of that event, like someone screaming, you know, or the fact they thought they were going to die. These things are blocked out by the brain. You know it happened, but you've lost sight of the impact that it has on you. People don't know the impact that these events have had on them. We call this the firewall effect, Sheila and I, and we'll give you a link to something about our research later. Now, but the thing about firewall memories, like suppression, firewall memories, you know, you anything that is related to that particular memory, maybe somebody's accent or you know, expression on their face, or something that's happening to you currently in your life, these things will make you, it will get you to recall what happened before, but you won't recognize that that's what's causing your problem. It's all happening outside your aware brain. So you just feel low, and paradoxically, that makes you feel worse, the fact that you can't remember it, because your unconscious remembers it, but not your conscious mind. So here we have what we call, it's a kind of continuum of bad feelings, of emotional distress, running from depression, anxiety at the bottom, through low mood to peak performance, because we're on this continuum. All of us are somewhere on this continuum. What takes you down is the negative triggers that pulls you down to depression and anxiety. What takes you the other way is priming, and we'll go into that. That's being fed information that you're okay, that you're all right, and accessing positive emotions from memories which help you out, because memories can help you out to deal with this, and we'll go into this in a minute. So next question is, what do you do to feel better? You will have time for questions, obviously, in about 20 minutes. So, Sheila?
Yes. Again, in the Q&A box, what do you do to feel better? Now, somebody mentioned that at the beginning, that there were some things that I'm not saying, you know, that they know puts them better. And I know sometimes there's a bit of problems accessing those, but I'll pick up on that just after you answer this. So have a think. What are your favorite strategies? Going for a walk, yeah, that's a really great one, and I think we've all become much more aware of the benefit of walking outside over the pandemic, and the influence and beneficial effect of nature, which is really, well, it's great for us, and it's also great for nature if we can help protect it more. Listen to music, walk the dog. Yeah, pets have got a very special place. I think they're very non-judgmental pets, and we. You know, the counterfactual effect that Alistair was talking about was all about self-judgment. We judge ourselves. So it's, you know, we can learn a couple of things from animals. Exercise, yeah, I think that's a great one. Yoga, totally. Got lots of breathing in it. Talking about breathing in a minute. Going shopping, a wee glass of prosecco, yeah, great. So only as long as it's not, moderate drinking, sensible within government guidelines. Baths, yeah, that's exercise, walking dogs, exercise, go for a walk, eat, yeah, again, as long as it's healthy eating, exercise, listen to music, dog, yeah, lots of colouring, yeah, that's nice. Art,
Yeah,
again, it's a really good one. Keep to a routine. That's a good one. That's about that sense of control, isn't it? You've got a control over your environment, because I think often, as someone said, I think in one of the comments, how do you feel when you're depressed, is lack of control. So I think and also it's the familiarity as well. So there's that sense of safety with routine, and automaticity. Perhaps we don't have to think about things too much. Try to exercise if you don't feel like it. Get outside, schedule relaxation, eat chocolate. Chocolate's really good for you, particularly dark chocolate. I like, yeah. Walking, meditation, breathing exercises, think positive thoughts. These are all really great. Find out what your triggers are. Yeah, that's a really good one. Time with pets, mindfulness. And someone's got a saying in their purse. Yeah, that's like an internal mantra. When I feel panicked and low, I work out. Really helps me. Yeah, I sort of, mantras are sayings that we can say to ourselves. And the thing about those internal sayings, I guess they're affirmations, is if you phrase them all positively, so rather than anything like, I don't want to, you says, I want to, so it's a positive thing, then they're extremely successful. And that idea of just having them, and they're about yourself, what you want to achieve, what you want to connect into, then they are very, very successful strategy. Taking a cold shower lifts my mood. That's a bit like all the swimming, cold water swimming. I think that has been shown to help low mood. Pampering, looking after yourself, giving yourself time. Oh gosh, there's lots and lots and lots. That's good. Really great. So one, it's good to recognize that you do have coping strategies and lots of things that work and work. So what's the next slide, Alistair?
Right.
Oh, yeah,
okay, yes. I mean, another way of making yourself feel better, which a lot of these things that you've mentioned actually do tap into, is the link between the body and the mind. I mean, Buddhists recognize this. What happens in your mind is almost entirely done through your body. The body is where you feel your emotions. So what happens is, we're going to talk about applied relaxation, because this is a particular type of relaxation that is very effective. Our own app uses a lot of applied relaxation. This is one of the things that you learn through the app. So applied relaxation is I'll briefly run through it. What you do in applied relaxation is you do something called Jacobson relaxation, which involves squeezing your hand and then relaxing it. Squeeze your hand, notice the tension, relax, and you notice the difference, and you work through the muscles in your body. Another thing is, as you squeeze the hand, you take a deep breath in and you hold your breath, and then when you relax, you breathe out. So you get a big rush of positive emotions. It slows your pulse down. I mean, your body tells you that you're stressed because your pulse speeds up. And if you're fit, this is where being fit helps. If you're fit, then your pulse rate is slower anyway. So your body is not telling your brain, hang on, you're a bit stressed out. So, and the other thing is breathing. You breathe in and out, deep breaths in and out, slow, deep breathing in and then out. So these three things are called applied relaxation. It's been shown, it's accredited and recognized as being a very, very powerful way, and we've found this ourselves of making yourself feel better, because once you have got the positive emotions in your body, these good feelings in your body, they feed straight into your emotional brain and they make you feel good about yourself. Also, what applied relaxation does is it switches on something called the parasympathetic nervous system, so your pulse becomes regular in a kind of up and down pattern, and it affects every part of your body. You're more likely to smile and interact well with other people. You're more likely to think positively, and the parasympathetic system also switches off the sympathetic system, which is your fight or flight system. So all of this stuff in applied relaxation will make you experience positive emotions. And once you've got those, then this has all sorts of beneficial effects on your mind. And it's a combination, as I say, of Valsalva maneuver, holding your breath, Jacobson relaxation, and slow breathing into your stomach. I think Sheila's going to take us through this shortly. And it increases the blood circulation to the brain and the body, feeds into the emotional brain, and it changes the brain rhythm because you slow your breathing down, so your brain rhythm slow down, which switches you into something called the default mode, which is where you have access to the whole lot of past events, and you can pick out things that might allow you to find more helpful memories to guide new solutions. And this is something, again, we've done research on, but we won't go into that now. So over to you, Sheila.
Thanks, Alistair. So yeah, that's the theory of it. So let's just experience this for ourselves. And so just make yourself comfortable for a moment. Yes, most people are sitting in a chair. And just take a moment. We'll start off with squeeze your left hand, right? Squeeze it really tight. Hold that. Just do what's comfortable. If you've got arthritis or anything, just, be careful. But squeeze your left hand. Hold it for a moment and notice the tension that's developing in your fingers and your forearm. Be aware of that, notice it, and then release that and let that hand relax. Now do the same with the other. Squeeze your hand, hold it, so you can notice that tension in the fingers, the hand, the forearm, and release it. And let your hands rest gently on your lap. And now shrug your shoulders up to your ears. Hold them there for a moment. Notice that. And release them down. Shoulders are a really common place we carry tensions. Just do that again. Shrug up to your ears. Hold it. And then release. And let that feeling of more comfort in your shoulders go down your arms, your hands, heavy on your lap. And now I'm going to stretch out your legs and flex your feet up to the ceiling, your toes to the ceiling, tensing all your legs, noticing it. And relax your feet down. Do that one more time. Stretch your legs, flex your feet. And relax them down onto the floor. Now we look at the face and just lift your eyebrows up to the ceiling. Notice your forehead wrinkling, and then relax your eyebrows and your forehead. Screw your eyes up and release. Aware of the difference. Make a funny face with your mouth, your jaw, maybe a grimace, or push your lips forward. Holding it. What's important is to hold that for a moment, because as you release, you notice the difference. I notice particularly that your tongue is on the floor of your mouth, so that your jaws relax, because the jaw is another place that's very common to carry tension. And as you do that and just allow all the muscles in your face to feel more relaxed, you can allow your eyes to close and begin to draw your attention inside your body and to notice your breathing. And taking a deep breath all the way down to your belly, pushing it out as you breathe in. And then breathe out, pulling your stomach in or letting it fall down. And then breathing in to the count of 4 in your mind. There's a hold as after you breathe in, and then breathe out 2, 3, 4, a hold. And breathing in 2, 3, 4, hold that breath. And breathe out 2, 3, 4. Just allow your mind to scan your body, releasing any tensions you notice, giving yourself permission to let go of tensions, to use only the muscles you need, and to follow your breath. And just notice your feelings and your awareness of your thoughts in your mind, and how perhaps they feel a bit more distant, and we're able to observe them rather than being in them. That sense of being an observer within yourself. That brings a sense of calm and balance and neutrality in your mind and body. Just hold that for a moment, absorbing it in you. Hold that sense of being in that internal awareness state of mind-body balance. And as you allow yourself to open your eyes, come back to this presentation, bringing that with you forward so that you're able to get a clearer, more refreshed sense. And I hope that you notice that sense of separation from your thoughts, not in them, but observing them. That's a sort of mindfulness type state, but it's also it's the state that you get into when you're walking, when you're cuddling your pets, when you're reading, when you're coloring. There's lots of other ways of getting into it, but most of them focus around the breathing, the body aspect, because as Alistair was saying, the body is, mind and body, they're separate. They're integral. They're not separate. And breathing is the quickest and most effective way into calming your mind is with the body. And then when you do that, all those ruminations, all those suppression thoughts, they're further away. And that gives that mental space that you can actually take a moment to connect with all of your coping mechanisms, all the things that helps get better.
Yeah.
So if something's a bit of a struggle, I can't do it, don't beat yourself up. Give yourself the opportunity to breathe and just begin to gently do a small bit of it. And it can make all the difference. So next slide, please, Alistair.
Other ways.
Yeah, so just as I was saying, these are all about exercise. Are so great because we talk about being in the zone, it's that automatic function that, you're not thinking, because really what you want to do when you've got low mood is you want to switch off your thinking brain because you're overthinking. And it's usually full of negative stuff. So the focusing on the body lets you switch that off, and then you're able to connect with more positive things. Next slide, please, Alistair.
Yeah.
And that helps you find the solutions.
That's right.
That you need. So next slide. So just to quickly at the end, because it's about 1:45 and I want to give you time to ask questions, is to just to say a little bit about the app, which is one of the resources, is that this is how it looks. And it has a lot of guided visualizations. There's a lot of, remember I talked about affirmations, about mantras, a lot of positive affirmations. And the Feeling Good for Life track, that's the green one there, that is the core track that we've done a lot of research on over, 15 years in the NHS. So we know it's very helpful when you listen. And one of the first things it does is it helps you relax, going through this tensing and releasing, and that helps you sleep better. And if we sleep better, we usually feel an awful lot better as well. And then there's actually a Sleeping Better track, and there's some other tracks too. Next slide, please, Alistair. And this Feeling Good for Life is the main track, and it's got all these different components. So it helps key you into your positive memories, your positive experiences, taking good things from the past to the present. And the reason, right, that this works is because the relaxation's first. So if you remember Alistair saying, why can't depressed people just cheer up? It's because they're so full of all the, it's all that self-evaluation. Relax first, get into that neutral zone, and you stop judging yourself. Someone has said things that help is acceptance. I think that's right. Acceptance is a really big core of accepting ourselves as we are. And none of us are perfect. What a boring world it would be if everybody was perfect, you know. Accepting ourselves and stopping that judgment, which is what's so toxic about social media. And then we're able to actually build up our self-esteem and our confidence. Next slide. There's a neat thing in the app that you can choose the audio settings like male or female voice, me or Alistair, and background music too. We do talk quite slowly, which can seem a bit weird at first, but so is to encourage the slow breathing. That's why we talk slowly. Next slide. And click through this. I mean, this is on our foundation, our charity website, but lots of evidence on helping low mood, depression, anxiety, burnout, and well-being and rehabilitation.
Yeah.
And the final one before I look at for questions is, do you want to talk about this and I'll just check the chat box?
Very briefly, these are all things that we've done studies on. The first lot, depression and low mood, very good results for that. It's such a simple app to use. All you need to do is listen, and it will take you through all the exercises. You don't need to go away and do a lot of homework. If you listen, it ingrains these helpful therapeutic methods and ideas in your mind. Anxiety, burnout, and burnout's one of the reasons we're here today talking to you, because we had a study which showed that NHS staff did very well recovering from burnout listening to the app. Each track is about 20 minutes long. Well-being, quality of life, stroke, very good stroke rehabilitation of carers and their charges, multiple sclerosis rehabilitation. It's very good for rehabilitation. It helps you to see your recovery, and it does the same for depression. These are all the one at the bottom. That's all the other things that it does. Increases concentration and focus. It's based on Olympic sport, so it's not surprising that it makes you perform better at work. It engages you with the work you do. I mean, all of you are working for health or social care, you know, and this means that potentially you have a good sense of purpose and meaning in your job, which a lot of people don't have. So you're lucky in that way. And I think the app will help you to re-engage with that. Chronic pain, headache, irritable bowel, all these things are stress related. So it's very good for all these things. And this is what happens. We'll give you a link shortly to this animation. I recommend you watch this. This is about our research, what our experimental research showed that what it does is it changes memories of past events that have made you feel bad, not consciously. It's all done in the unconscious mind. It takes you through the breathing. So it's well worth watching this. What positive mental training does is it changes the way you feel about past events so that you're no longer having this constant re-traumatization. Okay, so we're going to ask any questions now. Sheila, you put them in the chat box. In the meantime, I'm going to show this slide so you could take a photo of it or something. It's got a lot of resources for our for the app. It's got the research, the video channel, it's got the username and password there. So you might like to take a picture of this, and perhaps, Sheila, if you could moderate the questions.
Yeah, I'm just going to try and pick up. Oh, I'm going to maybe put in the announcement one this the bit.ly code to the sorry, I can't type and talk at the same time. Bit.ly code to the evaluation, because it'd be really super, you know, if we
Well, that's at the top, isn't it? Isn't that?
I know, but it's just, I think it's maybe easier to pick up from the chat box.
Oh yeah.
Someone was just saying, how do you change the voice on the app? You do that as when you go into a particular track, the play track, it has a button, audio settings
Audio
there.
settings there.
Mm.
And if you click on that, it offers you the option of Sheila, and you can have piano, guitar. There's all sorts of different types of music.
At the moment, people are asking, you can share the codes with your colleagues. Please share the codes with all your colleagues. These codes are not for your patients, unfortunately. If you're in Lothian, we've got patient codes, and we're hoping that we can get patient codes. But for Wellgood and User Positive are for colleagues just now. And please share these as widely as possible. So that's fine.
I think if it's in your family, it's reasonable to use it as well.
Yeah.
Important to point out that we've never had a bad side effect from people using the app.
Absolutely, that you're right, Alistair. And no, please ask any comments, questions or comments. At the beginning, you were talking about expectation. I just wanted to add in, I was seeing a physiotherapist recently. I've got some rotator cuff problem. And I was telling him about expectation. And he said, yeah, there was a very big study in back pain, and said that expectation of recovery is the most important factor.
Yeah.
And I think this, what we doing and what the app taps into is visualization. Is that sense we can shift our expectation. If we feel more positive, we are more able to expect good things to happen in the future.
Yeah.
And we can, you know, the continuum of mood, we're able to move away from some of the things that hold us back, our negative experiences, form expectations. So
yes, and our research, I mean, one of the main things is just confidence, that it gives you confidence. Basically, there's one track called it's a short track called Confidence, and if you listen to that, it's 10 minutes. And our research with this group in Canada showed that it completely changed the way people felt. They had big bursts of positive emotions, and they were, you know, they had all sorts of benefits from just 10 minutes of listening. And all of that is in our research. It's fascinating stuff. And the animation is also, if you watch this 3.5 minutes, watch it when we finished, and it explains exactly how it all works. It's very useful.
Someone's saying, how do you help a person that has low moods who doesn't think that they need help? Well, how would you answer that, Alistair?
Well, I mean, it's obviously, you know, we had a guy who went to the Royal Edinburgh Hospital because he was feeling really bad, and the psychiatric nurse there said, well, you know, why don't you use this? Because, you know, I used it, and it comes from Olympic sport. And this guy thought, well, I play golf, so maybe that'll help my golf. And so he listened to it, and he had a huge improvement. You know, in fact, he won a golf championship after that. It sort of completely removed his, what do you call it?
Yeah, and I think,
but yeah, it's difficult. I mean, some people, you can't make people listen to this, obviously.
I think if there was something like, this person wasn't sleeping well, that, you know, that's a good way of saying, well, look, this app can help you sleep, sleeping better.
Yes.
Or there's another route. So it's not like you're working particularly on the mood, you're focusing on something else that they want to achieve.
Too. Chronic pain. This has been shown to work very well for chronic pain. Chronic pain is essentially an emotion, and this will reduce pain. So if somebody, as Sheila says, maybe they got poor sleep, you know, or maybe they've got a lot of pain. I mean, I use this almost all the time for sleep. Sorry, Karen.
No, just there's a few questions, so it'd be nice to get to them. Sorry to cut you off.
Sorry, carry on.
How do I best manage my anxiety and stay mentally positive while helping my son? Well, I think the thing to do is breathing. Breathing is the best thing for anxiety. You'll know that when you're anxious, you are you're breathing more rapidly. You know, and when people are anxious, you often hold your breath without even realizing, you know. And so it's just being more trying to get to be really body aware, and then you are becoming a role model for your son, and you can maybe do things together like walking or running or jogging or, you know, anything that encourages that, the sort of physical aspect. You could also talk about it and diary it. Journaling is a great way to become more aware of emotions and the triggers, and you can talk about but perhaps other routes, you know, what does the anxiety affect, and then talk about the thing that's affecting, so that you're focusing more on a positive outcome.
Yes, I mean,
rather than a sort of deficit, you know.
Although hyperventilation is something you could see people gasping and breathing really fast, a lot of us actually breathe faster than we need to a lot of the time. And that makes you feel anxious because you're not kicking in with this parasympathetic nervous system. All you need to do is slow it down. And the app teaches you how to do that without even thinking about it. It automatizes it. It makes it an automatic thing. And what you do, you just squeeze after a while, when you've been practicing, you just squeeze your wrist, take a deep breath in, and it's gone because you were already almost immediately in that state because you've practiced getting into it. Switch off your fight or flight. Amazing.
Someone says, is being positive to do with personality? That's really interesting, isn't it? And I think you can pick it up. But I did research.
Well, personality, you know, is it your personality? No, I would say it's more that these things, triggers from the past, and they just keep coming back and keep annoying you. I mean, personality types, as I said, the evidence is not good. The research that we did, and you can read about this in the research papers. The research we did with the Canadian University is that they wait a minute, sorry. What were we talking about? Sorry.
Personality. Yeah,
personality. Yes.
The research
they looked at what was the most important thing. Was it, in terms of feeling bad, was it your personality type, or was it what had happened to you? Very interesting. And the conclusion was, well, what's happened to you trumps everything else. Your personality is probably, the personality type you are, is probably because of what's happened to you.
And just to say that I had a recent remembrance. My dad was an identical twin, and he was in the Second World War, and my dad was depressed most of his life, particularly from about 40 on. Struggled with depression, had to stop working actually because he was so depressed. So I mean, I grew up with a depressed father, but his identical twin was a medic and didn't go to war and never had depression. So they were brought up the same. They went to the same school. I think maybe sometimes there's, you know, my dad was there's a real vulnerability. They were both very sort of soft, sort of caring people. But you know, when they hadn't seen each other for years, but when they met up, they were dressed identically. Honestly, it was amazing. I couldn't tell the difference from the backs. Same sports jackets, same hats, same glasses frames. It was so funny.
Couldn't tell them apart.
So that's a real sort of, you know, a demo of one that, you know, with twin studies, they can look at these things.
Yeah.
So what else? Someone said this is quite a tricky one. I'm afraid we're not going to really have time to answer it properly. So how do you approach someone with low mood who's using negative coping strategies, for example, alcohol, and convince them to try more equitable, positive coping methods?
Yeah.
I think you have to begin to understand, you know, as you say, it's a negative coping strategy. So they're trying to help them feel better, help themselves feel better. And that takes quite a bit of understanding and insight and opportunities. So that would very much depend on the individual. And maybe this is somewhere where somebody needs to speak to somebody, just to help guide them through if they can, or you have to give them a bit of time on that.
Yes, that is tricky. I think, you know, probably what's happening is they're using the alcohol to sort of self-medicate to calm themselves down. But that's a kind of vicious cycle. I mean, maybe if you say, well, you know, if you use it and you say, well, look, I find this very useful, it helps me to calm down, or you say that I was listening to this doctor who was talking about it and he uses it all the time and he's okay because of the, you know, because of using the app. It's a very kind of, it's so easy to use, honestly. I don't know. I'm sorry you're having that problem. I feel for you. I was brought up again with an alcoholic in my family, so I'm well aware of the problems that this entails. He did get over it though, and I think, you know, maybe if you listen to the app, you might be in a better place to deal with his kind of anxiety too.
Yes, that's right. It's always easier to deal with people if we feel more positive ourselves.
Yeah,
and you know that's infectious. Positivity.
Yes, because if you can say to him, well, you know, I can see how you might improve. You know, I'm sure you've got the resources inside you. This is what the mental training does. It helps you find the resources. It finds more positive memories for you, all done unconsciously, and puts them into your kind of processing modes. And then you don't feel your negative triggers anymore. It's removed your negative triggers. Watch the videos. The animation is very good.
So this last comment, someone says, will the app increase energy? Yes, definitely. Energy is associated with positive feelings.
Yeah.
Increases vitality. So I'm sorry,
it's used by psychiatrists too as well.
that's thanks, Alistair. That's it's 1 minute past 3. So thank you for your time, and I hope you have enjoyed it. And a recording of this, I believe, will go on the hub, so you'll be able to pick up all the references there. So thank you, Alistair, too, for your input, and
thank you very much.
Have a good rest of the day. Thanks a lot. Bye.
Okay.